is live streamed. So let me prepare all the material these final minutes, and then it will be easier to work. This is the one. Workshop and even homework. From the workshop is going to be sign up the homework. So I told them we're going to write down and write down and write down more and more and more and practice more these topics. Because it's important for them to get it in touch and see that it's not as easy as they think. I'm just relax with this. Then, of course. Hi, Fabi. How are you? Hi, Fabiola.
Hi, I'm sorry, I'm here.
No, that's what we
de C-retinol y todo transretinar. Mientras que la rodopsina,
don't worry. Everything's okay?
Yeah, today the doctor is giving us a extra class, but it's supposed to end earlier, but that was not true.
No, it usually happens, don't worry. So, from yesterday, any questions, something is not clear maybe?
No, I think everything was clear.
I think everything was okay, right? Because it was not a long session. And
yes.
Of course, we started with the most basic studies and research information. So in that way, as I was telling you in the group, it's better if we start working with medical cases. And then case report and all those data. So let me share my screen. Can you watch my screen? Is that okay?
Yes.
Okay, so let me fix it. Now it's better, I think, okay? We have two cases. And of course, we have some topics to write down. In the order you're in first year, well, it's a good point for learning how to ask correctly, because it's not a topic at this moment in the career, right?
Yes.
You're on the basis, on the anatomical basis, physiological, embryology, biochemistry, those important facts for all the career to support the information that now we must start working with your classmates. But let's do our best, okay? I understand that there is not the complete information you might get, but there's not a problem. I'm going to consider this situation, okay?
Okay, thank you.
So the first case, can you read it, please?
You're in your consulting room and receive a patient. Bernardo Rocha, 52 years old, security ward. Doctor, I've been feeling this headache since I started working at nights and drinking more coffee 2 months ago. But from yesterday morning, the pain is becoming worse. There is no relief taking painkillers.
Yeah. So at this moment, you are receiving this patient. It's the first time you meet him, and you must start getting more information, right? And we talked about it in the first class at the beginning.
Yes.
So now you can tell me all the questions that get in mind for asking your patient.
Oh.
Yes, be as creative as you want. You have, I think, general data in the information that he's giving to you. And of course, in this general data and general information, name, age, of course, is a man, and the profession, what he does. But you need to know how to ask as soon as possible, so
Maybe
fast.
the phrase could be, what kind of lifestyle do you have?
I'm sorry?
I was telling, maybe it could be one, like, what kind of lifestyle do you have?
What kind of what? It's not a clear
Lifestyle, like,
the lifestyle.
I'm sorry. Yes.
Well, when you ask about lifestyle a patient, it's possible that he's not understanding the question and tells you, I do my best. I do everything as a normal one. And that's not a correct way to ask. You could ask him about, now at this moment that this patient is with pain, how you could start doing this. We have a mnemotechnique for asking patients that is very useful, but now it's time to you to search for it and get the information, okay? It's okay. Alicia, every letter is a word. In Spanish is Alicia. Catherine, okay. And the complement is Fredusa. Just for help, because it's not an objective to give this part. Let me write down. So with many of these questions, you could get the correct information. And of course, you are going to have all the topics you need to know. It's just for you because you are studying and you use this mnemotechnique when you get in the third year, I mean. Miento. I don't remember the C letter. I made another kind of questions. Let me remember them and I will show you. You have to start about the onset, the beginning. What happened when it started? How was the first time you felt the pain, for example? Can you describe the first moment you got this kind of pain?
Okay.
Let me remember them. Too much time, I don't write down the Alicia producer. I was not prepared for this, I'm sorry. But that's okay, it's gonna help at this moment. And you can find it, look for it in the internet, you're going to find lots of pictures explaining this. But you have to try to use this mnemotechnique for asking the questions that you consider necessary to get the diagnosis or the probable diagnosis.
Okay, I found it.
Yeah, okay, about the onset, the aparición, the inicio, the beginning of the problem.
Yes, it's about location, radiation, características, dicen en algunas imágenes.
Yes, could be characteristics.
Y
yes, and
intensidad y atenuantes.
The attenuantes or painkillers, for example, or many positions or changing in places or relaxing time that could help to avoid the pain. But in this case, how would you ask for it with this? You have this patient, which questions you will make to him? Because it's gonna be homework.
Yes.
This first case is the easiest than the second one.
Oh no.
Doctor, I've been feeling this headache. His principal complaint, which one is the complaining situation?
His first complaining about the headache, that it's being worse with the time.
Yes. Headache is the principal, the cardinal symptom, right?
Yes.
Yeah. Ask all if you want about the headache.
Okay, he said that it begins like 2 months ago.
Yes, how you would ask? He's giving you some information. Dr. Fabi, I've been feeling this headache since I started working at nights and drinking more coffee 2 months ago. But from yesterday morning, the pain is becoming worse, the worst I had. There is no relief taking painkillers. So now you get few information, right? Which questions do you have? You would like to ask?
Maybe in what part of your head feel the pain?
Okay, could be. Now you can see, you can watch my screen, right? How to ask about the health and illness, right? You have all these questions and synonyms and many ways of asking for.
The screen is actually the document.
It's still there.
Okay. In the presentation.
Okay, let me correct it. Let's share in another way.
Right.
Okay, can you watch my screen?
It's charging.
Yes.
Yes.
Yes. How to ask about health and illness? Do you have this presentation so you can check it and then complete the homework, because it's gonna be homework for everybody that comes to the workshop. What brings you in today? Now he's telling you the headache is the situation is bringing the patient to your consultation room, right?
Yes.
What seems to be the problem? What hurts is the same? What are your symptoms? What is going on with your body? What do you feel? How do you feel today? So now all of these first 3 points are showing you the beginning of the anamnesis.
Yes.
Right? So they are taking you the situation that, oh no, I'm with headache, please help me. And the patient is But he's giving you more information. How long has been this going on? 2 months ago, but yesterday it was. Okay. Has the pain getting worse? It's worse. There's no relief. Okay. What is general health like? Not lifestyle.
Oh, okay.
You have headache.
Okay.
Or another question, how is your health generally? Clearly, right? Now you're getting the correct way of asking for. Okay, when you get these first questions, you can go to your patient and tell him, okay, now we have the information, he's with headache. It is with 2 months, but worse from yesterday, okay?
Mhm.
From yesterday morning. And no relief with painkillers. So, any other questions you consider it's okay to do, to ask for? What you need to look for in this situation? You need to look for this. Do you smoke? Do you take recreational drugs?
Do you
Do you
think
drink
I'll go?
alcohol? How often? He's drinking coffee. He said drinking more coffee, but how much is more? When you consider the point that the coffee, how many cups of coffee are going to be a bad idea, taking into account the age and the sex of the patient. This is an important data because we have studied in medicine this situation, and we consider that more than 5 cups of coffee could be the worst idea for many patients. But we have patients that with 2 cups of coffee are running crazy, right?
Yeah.
And it depends on the way you prepare the coffee. It's not the same, the real cup of coffee is the American coffee, just the coffee you boil without adding water as we make in Bolivia. Right? In Cuba, the cup of coffee is the smallest one we have here in Bolivia for sharing. The smallest cup of coffee, that kind of toy. And that's the cup of coffee we use for studying because they drink at least 7 to 8 cups of coffee every day. So we have lots of hypertension patients. But here in Bolivia, it's not possible to see someone drinking that kind of cup of coffee. So we must consider that situation. So he said how many cups of coffee he drinks a day during the day? 3, and at night another 3. Okay, there's a situation to consider. Do you have family history of this? Do you have a family history of? Then you can ask for more information about family information. Yeah, I don't know, illnesses from the family record, I mean, right?
Yes.
Okay, so first homework, write down all the questions you consider necessary to get the probable diagnosis, right? After the anamnesis, you take the vital signs and you get these records.
Okay.
Heart rate, 105, respiratory rate, 22, BP, 170, 110, temperature 37, SpO2, 93%. From this information, now you have the first sight of what is going on with your patient, as we said yesterday, right? And having this data, getting this information, you can get a probable diagnosis. Well, the diagnosis is there, right? And of course, you make a clinical examination, you check your patient, and you must write down the findings and the possible diagnosis in the case report. So you have to write down the questions, the findings as a list, and with all the information you got, make a case report and add the diagnosis and did, just until this part. no treatment, not anything extra, right?
Okay.
To Saturday night could be, I'm going to send it to you to WhatsApp. And that's
Okay.
it. So take a deep breath, you have the general data. The second case, it's not, I don't consider I will send to you, just the first one, okay? I'm going to
Okay,
send
so
one.
thank you very much.
Yes, the second one is harder, but it's a very common situation in hospital. Okay, so let me send you the pool for assistance. And if you have questions about how to do it, please send me a message. That's okay for me. And I'm gonna give you more data, maybe for your patients or I don't know, something with it. Okay, Fabi.
Okay. So, thank you very much and goodbye. Have a nice night.
Goodbye. Don't forget describing the findings. You have to write down the ones we were checking yesterday in pictures. Okay?
Okay. Thank you.
Okay.
Goodbye.
Bye. Hi. Hi, Belkin.
Hi.
Hi, can you listen to me? I can't watch
Yeah.
you. Yes, now I see you. It's I love your smile. It
Me
makes me feel
too.
comfortable.
I'm always smiling.
That's great. So, Belkin, you are listening Fabiola's case, and now I'm sending the homework. So just for people is coming to the workshop, because I don't consider it's a great idea that everybody has the same opportunities if they are not coming. It's not fair for you. You are making an effort and they don't. And no, it's not okay for me.
Yeah,
and in order they have all the information too, we can work on it.
okay.
So from yesterday, do you have a question, something that you would like to check again?
Yeah. I want to check the slide number 10, I think.
Number 10. Okay.
We talk about
okay.
This
one? Treat the
yeah.
patient, not the monitor?
Yeah. When we talk about of the ABCD, when we are talking with the patient.
Which one? This chart or maybe this one? Which is like this. I'm sorry, this slide?
No, next.
This one?
Yeah.
Okay.
Another way for talk about overall snapshot, because I don't understand very well the meaning.
Okay, the meaning of overall snapshot. Okay. And the snapshot is a site. Just for example, when you are in your computer and you take a picture from the screen, that's a snapshot, right?
Yeah.
Just a view of that specific moment, right?
Yeah.
Vital signs are the same as a snapshot. It means, for example, you go take the vital signs and see that everything's okay. You have the slide that the patient at this moment has normal vital signs for the situation, but it's just for that moment. It's a general idea because we have numbers, parameters that give us an answer for the situation that the patient is having in that moment. And that's all. The overall snapshot is like a general view of the situation just at the moment you are taking them. They are not useful 4 hours later or the next day. No, that's a mistake if we consider that the vital signs from 3 hours before are correct at this moment. We have to check and check and check and check again.
Okay, when we are writing the medical report, is like, you know, in Spanish we have the the thing with the patient refer, like current history is
the case report.
Yeah.
could be in Spanish the meaning, historia de la enfermedad actual.
Exactly.
Yes. In English, case report.
Okay.
In Spanish,
So,
HEA.
yeah.
Yeah.
Okay. It's the same order where in Spanish, historia de la enfermedad actual, objetivo.
Okay, from writing down the clinical history.
Yeah.
In many that is the same order, because a general documentation all over the world, and it's done by the Worldwide Health Association, right? The OMS is the line, all the topics are delineated by them. So we have the same topics to check, and the order is almost the same. The details that change are not important at this moment.
Okay. Well, I don't have more questions.
Okay, so let me show you what we are going to do today in the minutes we have now. Well, now where you are working at this moment, in a consultation room or in a hospital?
In this moment, in the consultation room.
Okay, you were in a hospital, I mean. You had your internship and take a lot of kind of patients. Okay, so let's try to do the second case with you.
Okay.
You are the GP on shift. Okay, you're tired and hungry.
Mm.
And there's a diabetic inpatient with the next vital signs. Angela Manriquez, 60 years old, university professor with BP 90 and 60, pulse 120, respiratory 24, temperature 38.3, and SpO2 89%. You call the patient's nurse and ask her about the patient. She says that the patient just arrived from the A room. She's a new patient in your room, on your floor. Then you make the secondary anamnesis. Now starts your job. Write down all the questions you consider necessary to complete the primary anamnesis and support the probable diagnosis. Of course, I'm not showing you the diagnosis because we have it. It's a diabetic patient.
Yeah.
So, tell me all the questions you consider necessary to complete this situation and to start correcting it, because she's she's in trouble in your floor, in your service.
Okay, the first one, let me see. And number 2.
Yeah, this is.
Blood pressure. Temperature is, let me.
Taking a first view of this patient has received a good treatment in the emergency room. I had a patient with this exactly situation, maybe not the same,
Yeah.
vital signs, because I don't remember all of them, but you have this situation is very common in Latin America to receive patients like this
I have
in services.
To ask about she take any pills?
Okay, so when you make the secondary anamnesis, what do you do? You start again as, well, you are new from her.
Okay.
You ask all of her, right? We have
when does she suffer the diabetes?
Yes, we have some questions to remind, right, that we take in the first presentation.
Mm-hmm.
Of course, what brings you in today, it's not according to the situation, because it's it's a hospital side patient, but we can use some of these questions to ask for the patient all we need, right?
What is your message? Your medicine? how often you take these pills, or you
Okay.
are you using insulin, and
Yeah.
what is which the doses?
Yeah. What more?
Um,
So
the symptoms right
organizing.
now.
At this moment, how you feel? Is anything hurting? Do you have pain? Yes, do you have pain? Where
Are you
is located the
thirsty?
pain?
Yeah.
Yes. Well, the homework is so easy. You have to write down all the questions you consider necessary to complete the primary anamnesis and to support the probable diagnosis. Of course, now we know it's diabetic. We know all of these vital signs. Sometimes something more is happening. This is a septic patient, just watching this. She's in sepsis, right?
Right.
She
I was
has,
thinking in diabetic ketoacidosis.
yeah, could be, perfectly could be, but you need to take lab tests for that. And at this moment, it's not objective to take lab tests, but that's okay. So write down all the problem, all the questions you need. Write down all the findings and the possible diagnosis. And finally, make a case report. Okay.
Okay.
With your case report and add the diagnosis, all the diagnosis you think go at the end. If you consider this is a diabetic ketoacidosis, that's great for me. It could be the first idea. That could be a pyelonephritis too.
Yeah.
Could be pneumonia too. We don't know, because there's no more information. And we usually receive patients like this, and the history from the AE room, it's not ready with us because they are finishing it. The patients go upstairs and that's all. It usually happens in our countries, right? They send the patient and we must start everything considering that the patient is going to stay into the hospital.
Could be an alkalosis too.
Yes, try to get the idea and send me. The second case I'm going to send you by WhatsApp until Saturday night. It's okay?
Okay.
Yeah, so take your time, check more questions, organize your ideas in the order you consider could be useful for get fast information. I'm not asking for treatment at this moment, and even though I'm not asking for lab tests at this moment, but if you want to add them, just the anamnesis, yeah,
Yeah.
just the anamnesis and
The diagnosis.
yes, and the probable diagnosis because we don't have lab tests at this moment.
Okay.
And if you consider it's necessary to refer this patient to a specialist, you can tell me it's necessary to refer to, and you can tell me the specialist you want to ask for.
Okay. We need the glycemia too.
Yeah, that's the first data we need. And I'm not adding this because lab tests, they are going to take an hour more and you have to expect, and of course you have many things to do at the beginning, right?
Yeah, right.
We are acting in the way I know we work in our countries. These cases are starting. We are going to work with cases like this, all of the workshops, and we are
I
going to
was
support.
thinking this patient is in the hospital from my country.
Yes, it usually happens. It's very common to get this kind of patients in our countries. In hospital, nobody knows what happened on when the patient is into the hospital. They said you are new when you came from, right? So I'm going to send it to you by WhatsApp.
Okay.
And this is just one case. I prepared two cases, but with one we can start. Oh, did you fill the pool?
No, not yet.
No? Okay, let me send it to you for assistance. Yes, can you watch this?
Yeah.
Okay.
Okay, and your weekend?
Yes, thank you so much. Enjoy your weekend too, practice.
I think so because I have to study and make my homework.
Yes. Yes, do this homework, please. Complete it and send it to me on Saturday night. I'm going to read it and we are going to work with your answers and complete the case in the
Okay.
second workshop because we are going to study lab invasive and non-invasive studies. Okay.
Okay.
Lab test, X-ray, CT scan, everything we can imagine because the Monday presentation is too long, but that's okay. It's going to be helpful.
Okay. Bye-bye.
Bye. Have a nice weekend, Belkin. It's nice to see you. Bye. So now I have 2 students with homework sent. Let me see who's the third one. I don't remember. Ruth, oh, it's strange. Ruth didn't come at this moment. Let me check the WhatsApp. She usually tells me when something is not going. Okay. Well, let me write them to her. Oh. Well, let's wait for her. What's up? Ay, ay, ay. It's not okay to be tired. There's no answer from Ruth. Okay, don't worry. Don't worry, she's come. Fabi, where is Fabi? Let me look for her. There's no Fabi. Okay. That's Fabi, case one. Well, let me send them. Thank you. Deadline. Wait. There's no answer from Ruth. Well, let's wait. It's doing nightingale. Yes. Now the second. So Belkin surely happens. Belkin. Where's my friend Belkin? There's Belkin. Mm. Right. Let's put well, there is no root. So workshop. I over here and write down the preferred. Okay. Okay, there's no answer, so let's wait for Johan. Well, there's no answer from Ruth. So let me look for who's the next one. Johan, maybe Johan would like to get into the workshop. Let me ask him. And you want to the workshop? No. You want to come into the workshop now? Didn't do it. Well, let's wait. And Claudia, I have no answer from her. No worries. Well, okay. Let's wait. There is no answer from them. No one says anything. Maybe Johan is studying. Well, of course, I don't have too much to do to say because it's not for me. Good number. We have to organize all these stations. There's a bit mentioned. There's, science. Hi, Johan. Hi, Johan. Can you listen to me?
Yes, I can hear you.
Yes, how are you? I hope you're studying. Hi, Johan. Maybe connection disturbances, maybe.
Yeah, I was studying. I hope, I expect that, I don't know, different.
I know you're prepared. I'm sure about your capabilities, so don't worry.
Yeah, the last exam, I was so tired and I was so hungry.
Yes,
And
you were in a bad moment.
yeah, and and I had to leave when I finished my job because other doctors has to enter, and so I had to go to home or I had to stay in my car, and it was
Yes.
a bad situation, a moment because I couldn't like go to the car and because I don't have enough lights or enough like
Hello.
table to write.
Okay. So don't worry. Tomorrow we are going to solve the second chance. Yeah. The new test, of course, is gonna be different from the one we made, the A and B that we have in the group. And as I was telling you, it's gonna be harder because, well, you have more time for checking data.
Time. Okay. Okay. It's okay. I
Yes,
think
you can
it's
do
gonna
it.
be
I'm sure about it. Any
for that.
question you have, something you would like to check before the test, or maybe
I
from the
saw that
class
you.
of yesterday?
Actually, I saw that you sent something. The last slides was the 9, right?
Yes, the 8th one from Monday.
It, yeah, and I saw that you sent that we had to study until 9
No.
slides.
No. Let me open the group. The WhatsApp group.
Uh,
I said
number 8.
that you must study until number 8.
Okay.
The number 9 is from the yesterday class. It's not gonna be into the test, of course, until number 8.
Nice, perfect.
Okay?
I was afraid because I didn't know. I was scared. It is a lot.
No.
I saw
Don't
some
worry about it.
presentations. The
Yes,
gastrointestinal system
until number 8 just.
is a
The
lot.
number 9 is from the second model. It's not an objective to talk about it at this moment, or to take an evaluation of this, I mean.
Okay.
But
Scared
from the
because
class of
you scared.
yesterday, you would like to ask something, or from any other class maybe? Yesterday was easy.
Yesterday, I remember that was a short class.
Yes, was
And,
easy, was short. That was not too many topics to take in count because were just the basics.
yeah,
But
I'm okay. I think.
yes,
Okay.
yeah, there's not too much information, but with those basics topics, we have 2 cases to talk about. And well, you're in a consultating room, right?
Okay.
Or you are on shifts?
We are one?
You are we are in a consultating room, right? So you go a few hours and then go home.
Oh, yeah.
Okay. So considering you are in your last year of the career and still need more practice and practice and practice, because medicine is practice, of course.
Yeah.
I'm preparing 2 clinical cases that I'm sending everybody as a homework during the workshop, because we are going to work with this case, this workshop, and I think 2 more workshops then, and solve this situation. This first one is for you.
Nice. It's okay. Of course, it's
It's going to be helpful for you because you're doing it at this moment and you have the idea and you have fresh information to ask
not only
for.
but yeah.
Yes, you have fresh ways to ask for. So let me read it. You are in your consultation room and receive a patient. Bernardo Rocha, 52 years old. He is a security guard. And he says, Dr. Johan, I've been feeling this headache since I started working at nights and drinking more coffee 2 months ago. But from yesterday morning, the pain is becoming worse. There is no relief taking painkillers. He's complaining of this situation, right? First question, and you tell me at this moment what you would ask for. Write down all the questions you consider necessary to get the probable diagnosis. Which questions you will make to your patient? Now show me you are ready for this part.
I just have to write it, or I have to tell you.
At this moment you can tell
Excuse
me. That's okay. Let's practice with this. Tell me what.
Hello.
What? Yes. Tell me the questions you have at this moment. Which one is the first question you will ask to your patient?
Maybe how long?
Tell me the question. I'm your patient. Ask me. I'm not a doctor.
Okay.
It's killing me.
Hey, Miss, I don't know if you can tell me how long is your pain?
Oh, I just tell you it's 2 months, but from yesterday is the worst pain I have.
And
So, can you watch my screen?
Yeah.
Do you remember these questions we were talking in the first presentation? How to ask about health and illness, and we have more questions.
Okay, let me see some questions.
Yes. We have some, well, many ways to ask for information, right? And those are just examples for having an idea that we must be creative and ask for the correct way.
Okay, I got it.
I mean, in order to get the correct information, as we were talking yesterday. So what we're experiencing today, the headache. It's the same as we say, why you came into the hospital today. Of course, the headache. What seems to be the problem? The pain, the headache. Again, what are your symptoms? He is just telling us the headache. Well, we must look for more symptoms.
Okay. What are your symptoms too?
Yeah.
Do you have any other symptom?
The patient just give you this information at this moment.
Okay.
You write down all the questions that you consider necessary, and of course, you are getting about another symptoms. All of them are going to be your findings. Write down all the findings and the possible diagnosis with these findings, right? Make a list. Organize your ideas and make a list with the findings you could have in this kind of patient. Remember the class from yesterday with the basic studies we make. After the anamnesis, you take the vital sign. After the anamnesis, you take the vital signs. You have the heart rate, 105, respiratory rate, 22, BP, 107, and 70, 110. Oops, it's too high. The temperature and the CO2. You have the diagnosis here.
Yeah.
Yes.
I have the reason.
Of course, you have these vital signs, and you know as a doctor which ones are going to be your findings, right?
Yeah.
So write down all the findings, medical terminology, of course. And with all of this information, write down the case report. Okay, make a case report. And you know, as we were talking in the other classes, the case report not includes the diagnosis. At that moment, we talked it that way. But at this moment, we can add the diagnosis.
Miss, I have a question. I'm sorry.
Tell me.
What is findings?
Tell me.
What is findings?
The findings. All the signs, everything we look for in the patient as a doctors.
Signs.
Yes, signs or findings. That's the same.
I got it. Okay, in that case, I'm gonna ask for air, air, ring, I think, ringing.
Well, you make this homework and send it to me until
This is
Saturday
a
night.
homework. Okay,
Yes, it's for
when?
homework until Saturday night. So
Saturday
today,
night.
prepare for your test for tomorrow, and then after the test, start doing this because it's easy for you.
Okay.
You're almost my colleague. You can do it. It's easy. You do it all the time. And if you consider to refer the patient, tell me which one could be the best for him and write down the referral letter. I sent you an example in the 7 or 8 presentation. I'm not sure, but if there is any question, send me a message and I'm going to answer you.
Okay. Okay,
It's
I'm gonna
easy.
try to. Yeah, it's because it's in another language that is not my first that I have to think, and sometimes I have to translate. But I think it's
You
gonna.
can do it. You can do it. I'm sure about it.
Thank you.
Yes. So you got the idea, right? I'm going to send it to you by WhatsApp at this moment. Give me a few minutes, please. And that's all.
Nice.
So from this case report, from this first clinical situation, we're going to work the next workshop. Next class on Monday is going to be about invasive and non-invasive studies, right? So adding that idea, we're going to work on Tuesday.
Nice.
Yes. You see, it's like going step by step, right?
Step by step, I like this kind of practices.
Yes, that's an interesting way of doing these topics.
Yeah, I think it's that the way that we have to learn.
Yes.
Because it's the work that we're gonna do. All the.
Yes, we're going to make all of our lives. Yes, can you fill the pool, please, for your assistance?
Yes.
Yes, thank you. You're going to watch patients like him, like Bernardo, all your life, all your practice time. And that's important to get organized, the situation, right?
Yeah, to organize ideas and the language and how to be like natural, how to sound natural. I did it. I feel that.
Perfect. So thank you so much.
Okay, thank you. Thank you for your attention and your time. Have a nice day.
Yes, see you tomorrow and relax. It's gonna be easy for you. I know you're going to do your best.
Okay, thank you.
We are going to start at 8 o'clock, okay?
8 o'clock, nice, perfect.
Yeah. Is that okay for you, or maybe you are still working?
I finished my work at 8 o'clock. So I am in the clinic. I had to move to another. I think I can find a space in my clinic, maybe another room, and I'm gonna try to eat before
tomorrow
that.
Is an extra day, so we can get in accordance with the schedule, and there's no problem.
Perfect. For me,
See, it's an extra opportunity we are considering with the superior, with academical superior. For there's not a closed schedule. I mean, what time is the best for you? In order you have all the space and you're relaxed for doing the test. Of course, I'm going to help you.
9 is perfect for me.
At 9.
Yeah, 9.
Yeah, it could be better at 9. Let me send a message to the other students and we start at 9 because I think for them it's okay too.
Yeah, it's gonna be
They
better for me
told me
because
that they had a free night, so there's no problem. So if
yeah.
they come earlier, there's no problem. Your 3 students are taking the test. I have 3 different tests. There's no
Oh,
problem.
perfect. A lot of. Oh, okay. Give me the easier.
Now we are going to shuffle it.
Shuffle.
Yes, you're going to see. I'm going to ask you, for example, at 7, choose A, B, or C. I think if there's no one who asks for to come tomorrow, someone who doesn't need to take the test again. Yeah, only you 3. I'm going to ask you 3. Choose A, B, or C.
Oh my God.
And that's all. If you choose B,
Oh.
okay, your test is gonna be the B one. If you choose C, it's going to be the C. That's easy.
Nobody can cheat with that.
No, actually, you see the key answers of the first tests.
Yeah. And so
You were-
and I knew that my exam was so terrible.
But the situations were very, very similar.
Mhm. Similar
Just
images.
but don't worry. I'm sure you can do it. I'm sure. I'm completely sure. I trust on you.
Thank you so much for this.
Yeah, don't worry.
Help.
Okay. Now I'm sending you this homework. You received number 1, you are on consulting, all the data.
Well, everything.
Yes, by WhatsApp, I send you the homework, and at the end says that the deadline is Saturday night, please. It's easy for you to do it. You can do it. You sent me the rewritten paragraph about the case report, right? I received yours.
Yeah.
And with you, I received just 3 rewritten case reports. No more.
3.
Yes, so you have a plus.
Okay.
You are working, you are doing your best, so I have to consider this. I'm sure.
Yeah, sometimes it's because my schedule right now is bad. I don't like go out in afternoon to my work because I cannot do a lot of things. I think the next month is gonna be better because they changed my shift, my schedule to the morning, and
Yeah.
I had the afternoon free.
Yeah. Well, sometimes it's not easy, the social service, but we have to do it.
We have to adapt it to the system.
When I was in my social service, I was living into the hospital all the time on shift. 24 hours, 7 days. And I had 2-3 days at the end of the month just for coming home and trying to sleep because it was awful. Can you listen to me?
Yeah, I have a bad connection. I'm sorry, but I can hear you, and I know that social service in some places, some countries are like more like harder. Here is like depending if you go to a hospital or if you go to a clinic,
Okay.
another town or another city. And right now, I think my social service is easier because we don't have a lot of patients. We have like 10 patients a day, or just for me, right? 10 patients
Okay.
or 15 patients.
Wow.
More
I am by
patients that I
you.
have in one day, like 20 patients in 6 hours. I'm working just 6 hours and 2 hours of capacitations and courses.
But that's okay. That's great. I remember in my social service, as I was telling you, I was leaving the hospital. And if we have to refer a patient to the city, they were to my room and knocking the door. Iris, get ready. You have to run at this moment. Huh? What? Please use your coat and go to the ambulance. You're running to the city at this moment. Okay, let's go. And that was a different experience. I think from that moment
Yeah,
I get
yeah.
in trauma.
I don't
And
really.
that's why I love
I don't know
emergency medicine.
if you received a payment, a salary for your social service.
Actually not.
No.
No.
Okay.
In
Me
order
too.
I made the whole career in another country. The first step for having my title in Bolivia was doing the social service without payment for 6 months.
6 months, like me right now.
Yeah.
Yeah,
The
it's
same
the
like
same situation, I think.
yes.
Yeah, I don't know. I think I need an advice, or I need to think about it, because I have some options. If I want to get an specialty, a
Yeah.
postgrade, I can stay in my country and try to enter in the system of my country, or I can try to leave and go to another country. That's the reason of this course. And
Yeah.
I don't know, because here we have I'm doing my social service in the police clinic.
Yeah.
It's like a hospital, and I think that I can enter to a police, because there is a course that you can get it and enter to a police. It's like 4 months, but the payment, the salary is not like good. It's a salary of a police officer.
Yeah.
So many doctors, the salary is a little like higher, and the schedule achieved is like longer. You have to
Okay.
to work 8 hours, and in another jobs or works, you only have to work 6 hours here, and is the payment is better. I don't know if you get the course, you get a job in 4 months, but with a salary like is less than the salary that you expected to you expect to get. I don't know. Because I like the police. My father is a police officer,
Okay. So
and
you
the
have
reason
the
that
you have the
I have
experience.
yeah, and I have to think about it, because if you another reason is that if you go to a police academy, I don't. It's so hard to get a specialty, because the schedules and everything is hard. It's hard. It's just
Yes,
like
it's not gonna be a practical situation, I mean.
yeah, I like it, but the salary and the benefits are bad. I really want to do it, but they don't help me. They don't.
So that's the reason you're taking this course. You're expecting go to another country. That's great.
Yeah.
Which country you're expecting to go?
In my case, my favorite country to move is the USA, but I think it's
Yes.
harder. And in this case, I think it's better go to England, to United Kingdom.
Maybe
And so
to England or to the United States. Could be.
I
Could be.
think England is like better for me, better option.
Okay, so let's work harder with you with these case reports, with the clinical history and more vocabulary.
Yeah.
Let's work
Okay.
harder. Let's do our best for getting the correct information. I mean, the correct ways of expressions. And don't worry, as I was telling you, and I'm going to tell you again, I trust on your capabilities. You can do it, I'm sure.
Thank you.
Because
Thank
you
you
are
so much.
showing me.
Thank you so
Right.
much. I appreciate it. Well, I have to go to eat something, because I actually in my home right now. I was driving. And thank you for your time and for your attention. have a.
Don't worry, I'm here for listening to you, for helping you. Anything you need, let me know. And if this homework is something not clear, please let me know.
Okay, thank you so
Just send me a
much.
message.
Yeah, I appreciate it.
Just don't forget it. It's on Saturday night, the deadline. Okay? After that,
Perfect.
I'm not going to read more.
Okay, perfect. Bye-bye.
Bye-bye. See you tomorrow. Bye-bye. Well, Johan just go home. Claudia didn't come. Let me look for Agar. Maybe she can come to the workshop. There's no picture. Good. I don't remember. Maybe she's a girl, I'm not sure. Oh, I don't have. But I don't remember. Well, let me look for it here. Yeah, maybe just a minute. And there is always some time. Let's wait for her. Let me open her chat. Oh, that was the picture. Let's wait. Let's expect the answer. Let's finish writing down the sentences. Saturday. Vital signs. Hi. Oh, no. Hi, Agar.
Hi, good night.
Good night. Nice to see you. How are you?
I'm a little tired, but I'm fine.
Okay, that's great. Now let's work on the workshop. Yes, yeah.
Okay.
From yesterday, any question you have?
I have some problems with the understanding in the presentation, page 26.
Okay, give me a second.
Maybe, please.
To share the screen. The 26, right?
Yes.
Can you watch my screen?
Yes, I can see.
Okay, this one, the pictures.
Yes.
Vitreous, peritoneal, peritoneal subhaloidal, and superficial intraretinal. Those are situations that I was showing you in order to understand how is the fundoscopy seen.
Are examples? No. Okay.
Just examples for knowing that
Okay.
that's the situations you're going to find. Just examples. Of course, I'm not going to ask you with a picture, tell me the diagnosis. No, of course not. If I show you,
Okay.
give me the diagnosis, I'm running crazy because it's not easy. You need to make many more studies to do it. But for having an idea, for example, this thumb print, it's a very a very not common. It's a sign that you find in specific situations talking about brain tumors. When there is a compressive brain tumor, you find this sign, but you have to be on practice of doing the fundoscopy, the ophthalmoscopy.
Okay, I understand. Okay.
This is for trauma, again, trauma and retinal. I forgot the desprendimiento de retina. Yeah, you see this image in this situation. And this is for many another situations, from diabetes, for example, or from lupus, or maybe
lupus.
Yeah, in lupus you can see this kind of image. The elongated and frayed borders, the splinters, the flame shaped, you see it on lupus, but when it's without treatment and with many years of being with this condition.
Okay.
Yeah, just examples for having the idea that you could find this. And it's a good point for practicing, because you can receive letters, referrals, or information with this terminology. And you said, what? What's that? Yeah. What did they see? Yeah. The same on this situation is for trauma. In trauma situation, it's the best idea, if you have enough time and practice, to do it faster, to check the fundoscopy, to do the procedure. Not all the doctors.
Here in La Paz, they don't use.
Well, we can use it if we have
emergency,
it
right?
in the emergency room. It's not a common piece. It's not a common device. We get it. But if you have the opportunity, do it, because you can find some signs. For example, I was working at the Hospital de la Banca Privada in the emergency room.
Okay.
I was the doctor on shift, and I received a patient who had a car accident. Terrible situation, because he was not driving. He was crossing the street, and a drunken driver across on him, over him. He was with at least left arm broken, left leg broken, the femur was broken, the tibia broken. In face has an important trauma. And we decided to make the fundoscopy during my colleagues was trying to control the patient and start doing this. And we found the retina, the desprendimiento of the retina. We find it as another consequence of the trauma, and we found signs of brain edema. So it's important to do it if you have the practice and you have the material, the device. In La Paz, it's not common, but there are a few crazy doctors who make it.
Yes, I did my practices in Hospital de Clínicas, and they don't even have the fundoscopy.
Yeah, if they don't have the device, they are losing and wasting time. For example, when I was working in Cosmil in the emergency room, I had a teenager who was a diabetic patient, diabetic type 1, and well, we have to check her because she was losing her vision so fast. And making the fundoscopy, we found all the signs of the diabetic retinopathy with acute complications. So it's important to get the idea. If the brain doesn't know the complication, doesn't know the information, eyes are not going to look for this.
Yes, so and they don't take the importance to do this study.
Yes, so that's why I decided to put it, because it's important for us to remember and to know that, of course, it's a non-invasive test. Just need practice from doctors, and you can give diagnosis, the correct diagnosis, and complications. You can prevent more complications.
Yes.
You can help your patient in a correct way. For example, this one, the REN, I saw one of these in a premature baby. But when I was a student, After that,
Yeah.
I've never checked this situation again. In Cuba, I watched this. In Cuba,
Wow.
it's like a routine to make the fundoscopy when you have a reason to do it, not for all the patients.
Oh.
So it's important to get the practice and the resource to do it. That was I decided to show it with this detail because we don't take the importance. In the American schools, they do it as a routine during the trauma patients when they are stable. You stabilize your patient, and in the second evaluation, you have to make the fundoscopy and check the retina and the inside of the eye.
Wow.
So you have
Here,
to know
no.
what. No, here
We practice with with my classmate. I practice, but I never had the opportunity to do it with a patient that has pathology or something like that. I didn't do it.
I'm used to do it in the direct methods. The indirect, I never watch anything. With the indirect, I can be watching the nose or the mouth, not the eye. I can't get the correct position. With the direct one is the best. Here, we are used to send the patients to the ophthalmologist to do it, but it's not for the ophthalmologist, it's for the GP. We must do it. It's important.
Okay.
So, patients, if you have the opportunity while working or in the residency, do it, or more, if you have the opportunity to buy this device, do it. It's going to be so helpful during all your career.
Yes, you are right, teacher.
Yes. So let me show you the homework. I decided to send homework.
Okay.
Now, actually, what you are doing at this moment? Are you working, studying?
I'm studying. I'm preparing for the test for the resident.
For the residency.
Yes. My test is gonna be in February.
February. Yeah.
February. Yes,
which specialty you would like to make?
What?
Which specialty you are choosing?
Surgery.
Surgery. Oh,
yes,
you are so brave because it's not an easy specialty.
Yes, because I want plastic surgery, but we don't have here. So I have to do first general surgery, and then I can go to another country, maybe, to do it.
Yeah.
Plastic.
Yeah. So that's great. If you can reach surgery, would be the best for you. Which hospital you are pointing?
I was considered to go to Cochabamba. I'm not going to postulate here in La Paz.
No, but that's okay in Cochabamba. In Cochabamba, you see lots of situations that in La Paz are not close to see.
Right, and I want to know all other people, other culture, and other professionals than here is. And I think here is so hard to achieve a coupon.
Yeah, space.
One space. It's very hard. I think I saw the notes and it's very hard. No,
Yes, you're right.
I think
I tried to get into the residency here for 4 or 5 years. I'm not sure. I left 2 years and I said, nah, no more.
Yeah.
I'm going to rest and then take the test again later. Not at this moment.
Frustrating. I'm just getting crazy, stressed. I have a headache every day. I don't know if I'm gonna make it.
Yes, no, don't worry.
It's complicated.
So I tried to do as I was telling you. But, well, I passed the test. I was, for example, we had 10 spaces and I was the 11th.
Yes, that happens. A lot of my friends.
Nobody left.
Oh, what specialty?
intensive care unit is my objective.
Oh,
I love it.
yeah.
Yes, but I said, why just intensive care? Why not internal medicine, for example? If I would change it, I would be finishing the specialty now. And I said this year, why did I didn't change? I should do it. But everything has a
Because
reason.
some professionals take first internal medicine and then they take the intensive, right?
Yes, yes.
Um,
But no, I decided to wait, and I said, let's relax, enjoy my babies, and then try again.
yes, every I think that every person has the moment that
Yes,
is for every person, and I think if I don't make it next year, I'm gonna try one more, and then I have to work. This year, for example, I didn't work. Actually, I have been working, but I have two careers actually.
perfect.
My first career is physiotherapy. I'm physiotherapist.
Perfect. That's great.
Yes, and I have been working this year as a physiotherapist, but as a doctor, no, I didn't work, and I think if I don't approve the test, I have to look for a job. Yeah,
Don't
I
worry.
have to
When
look.
you start working, it's different. Your sight changes, and maybe changes the way you see surgery and decide to make something extra. I have
Yeah.
around 10 years working in Bolivia, and that's why I tell you. So it's not the same when you, as a student, decide on a specialty and then change. While working, you change the completely the idea, because you are on the floor, you are on the field and see the reality of the situation. And then you said, oh no, that's not for me. I decided to change. It happened to me. I wanted to be a pediatrician, but working, I said, no, I'm gonna be killing parents. I prefer another specialty. And I've been proving, and I get in love with intensive care. Emergency and intensive care is the topic, and I said, that's okay for me. And that's all. Yes, I don't know. I'm craziest with these topics, but they are for me. I feel great in that ways, and I don't feel stressed.
Yes.
Just look for the place you don't feel stressed, and that's the best.
You're right. I was actually in the internship. I was thinking oncology, but it's very
so
sad for me. I was depressed all the time. So no, yeah,
it's so sad. It gets some depression.
Yes.
Wait, now your classmate getting. So let me send you the case report to this clinical case to your WhatsApp, and from this place I'm going to explain you what to do. Please, Agar, fill the pool for your assistance, okay? Let me relaunch it. Yes, please fill the pool, Agar, and that's all.
Okay.
Can you watch this?
Yes, I can see it.
Okay.
Yes, I finished.
Okay, thank you so much. So let me send you the message in a few minutes, and that's all.
Okay, see you Monday.
Okay. See you Monday, bye. Hi, Ariana.
Hi, how are you?
Hi, how are you? Are you okay?
Yes, I'm good. What about you?
Well, everything's good today, at least, yeah.
For now.
Yes, at this moment, I'm relaxed.
Okay,
so,
glad to hear.
Yes, from the class of yesterday, any question maybe?
No, I don't think so.
It was easy, right? Not too long. It was clear. Just the basics, non-invasive
Yeah.
studies at this moment, the ones that we as a doctors can make, can perform, and that's okay.
Yeah.
So let's talk about a clinical case. I was talking with the guy about many things, but not the clinical case, yeah. But now
Okay.
I have to correct it, yeah. You are in your 5th year. So you are with patients in a consulting room or in a hospital, maybe?
Not really. I've been in virtual classes for almost 2 years.
Okay, at this moment you are not touching a patient, right?
No.
Okay, that's a problem because, okay, this first case is easier. The first one, let's read it, okay?
Okay.
You are in your consultation room and receive a patient. Bernardo Rocha, 52 years old, security ward. Everything's okay until this point. And he's telling you, Dr. Ariana, I've been feeling this headache since I started working at night and drinking more coffee 2 months ago. But from yesterday morning, the pain is becoming worse. There is no relief taking painkillers. He is with pain at this moment. With this first information, the complaint he has, write down all the questions you consider necessary to get the probable diagnosis. It's possible to make, right?
Yes. Okay. So I would ask him for how long, if he's done a night shift all the time that he's been in that work, or maybe he just started a few months ago. I don't know. That would
Yes,
be my
but
first question.
2 months ago, he started 2 months ago working at night, and since he started, he's drinking more coffee during the shift.
Okay, so the headache, has he had that before? Those symptoms, have he had them before, or just for those 2 months?
It, from those 2 months, the pain started. That was not regular pain, I mean, just for a few moments, but it was leaving the patient away, just resting. But from yesterday, the pain came to the patient, the headache is getting worse, and there is no relief. No matter the situation, the painkiller, anything, he's still with pain from yesterday morning, and you are today at night.
Okay. Does he rest when he goes home, or?
Yes, he goes for sleeping. Yes,
Okay.
you have the idea. You have the idea, you have many questions to ask for, right? And of course, let me correct it. I'm sharing in a wrong way. Can you watch my screen? Yes. And do you remember this chart of questions, right? The first
Yes.
presentation. You have here lots of questions to do to these patients. Many ways of asking for, maybe more questions you can create, you can do it to the patient. Be creative, okay? As much questions as you can, you must write down them. So write down all the questions you consider necessary to get the probable diagnosis, just talking.
Okay.
Going ahead, after the anamnesis, you take the vital signs, okay? And you got these values.
So heart rate is
105, respiratory rate 22, BP 170, and 110, the diastolic, the temperature 37, and the SpO2 93.
oh, the he's hypertensive.
Yes, a crisis, right?
Yes, that's why he has the headache.
The headache that is not going, but of course,
Mm.
you are not just taking the vital signs. You have them as a snapshot, overall snapshot, right?
Even the heart rate is a little bit high.
You have to look for more signs, more findings. You have to go to make your clinical examination to write all the techniques we know, we studied. And now at this moment you are practicing them without patients, but you are doing it. So write down all the findings and the possible
Imaginary
diagnosis. I'm sorry, I didn't hear you. Marie?
Oh, I'm practicing with imaginary.
Yes,
Like this
but
one.
it's going to be so helpful for you.
Is it my Yes, I hope this Monday that I start my semester, I'm going to see real patients.
Well, if you start, you're going to see that this is a very common, very common situation in our countries, in Latin America. Patients go and they feel the worst and they are almost dying. So when you get the findings with the semiology book, with all the information you got, make a case report, write down a case report, okay? Ari, can you listen to me?
Yes.
Yes? I'm sorry, I cannot hear you. Mariana? Are you still there? Yeah. Well, let's make the case report again. Considering this information and this information and this information. And just add the diagnosis. You know, have enough information for having the correct diagnosis at this moment. But if you consider, oh, Ariane is gone. Maybe, well, I know it's the connection. Oh, wait, let's wait. She's getting into it.
I'm here.
Yes, I know you are coming again. It's the connection. Sometimes it happens.
Yes, it's terrible.
Don't worry. I was telling you, you have the findings, you have the complaints, you have vital signs, you have the findings. Now write down the case report, okay? With all of the information you get. And in the case report, of course, it's not always the diagnosis, but at this moment you can add the diagnosis for having the idea that you get the point, okay? And additional, if you consider this patient, I'm sorry, this patient should be referred to a specialist, tell me which one could be the best for him. I'll write down the referral letter. I sent you an example.
Okay, I'm gonna refer him to the cardiologist.
Yeah, could be the cardiologist, another one.
Or internal medicine.
Yes, the physician, right?
Physician, right.
Perfect. I'm not asking for lab test, imaging test, electrocardiogram. I'm not asking for any kind of a study, okay? We're going to check this part of the studies in the next workshop according to your answers.
Okay.
Okay. So take a deep breath, you can do it. And don't forget, the deadline is on Saturday night.
Okay, Saturday night.
Yes. So any question maybe?
No, not right now. I think it's clear.
It's clear, and it's an easy case. It's very common in our countries, as I was telling you. And don't forget it, you are going to watch this kind of patients all the time.
Yes,
all the time. I'll tell you this experience. They come and tell you, I'm dying. You give them the pill that controls the BP. They said that way. And they say, okay. And two weeks later, they come again. And it happens.
I haven't seen patients in the hospital or in the clinic, but I've seen these cases in my family. So
Yes, you know, it's a very common situation, right?
yes.
So all the questions you have from this first part, we are going to answer in the next workshop, and you are going to get the correct idea. But I need you to bring all the findings you can get. Okay? Do you remember the fundoscopy?
Yes.
You are planning to go to England to make the specialty. So you must practice it. You must know how to do it, because in England, it's a situation that the general practitioner does. You have to develop this activity all the time. For example, in the American schools, Cuban schools, and European, few European schools, when you receive a patient in a trauma room, in emergency room, you stabilize your patient. When there is no risk for death, you go and make the fundoscopy in both eyes.
Oh, okay.
It's like an obligation, an activity that the doctor has to develop and get this data too, because we can make the correct diagnosis about, for example, I don't know, a brain injury or to find a retinal desprendimiento de retina, for example. So you have to do it. I don't remember how to say that. I'm thinking about it and I couldn't remember.
Yeah, me neither.
Yeah, but I'm going to find it. So you try to practice and practice and practice before going to another country, because it's important to know how to do it.
Here is
And of
medical.
course, when I talk about findings, of course, and I'm asking about the fundoscopy too.
Oh, okay. Okay.
And you have the key in the presentation from yesterday.
Yes. Yes. There's a
Yes.
there.
You have the there are more signs. The most common ones I write it down. I show you in the presentation, but that's okay. If you could find more, perfect.
Okay.
So I'm going to send it to you by WhatsApp in a few minutes. And you're going to have enough time for doing this.
Yes, I think.
After Saturday night, I'm not going to receive more reports, okay?
Okay, that's fine.
But I'm sure you're going to send me. You're so responsible in this with homework.
Yes,
Please fill the pool for assistance, okay?
Okay.
Can you watch this?
Yes.
Perfect.
Okay, I just submitted.
Okay. So see you Monday, Ari.
Bye. Have a good night. Have a good weekend. Bye.
Thank you so much. You too. Have a nice weekend. Hi, John Harold.
Hello, teacher.
Hi, how are you?
I'm great. How are you?
Fine too. Today is a better day, I think. I feel better today.
Okay. That's
so from yesterday, any question maybe?
No, actually,
not really, right?
Yeah,
it was a clear situation. It was clear, right?
Yes. It was also like a short topic, right?
Yes, the basics, just the basics, and that's all. And what? Why not? Just practice. Okay, so in that order, I decided to send homework, an easy one. And let me share you the screen. At this moment, you are working in a hospital, clinic, in particular consulting room.
Yeah, I work privately. I have my, how you call it, like a consultation, a private consultant. Yeah.
Private one, right?
Yeah.
Okay, so let me, it could be better. Yeah, that's okay for a private space. No, not a hospital at this moment. You finished the career also, right?
Sorry, I couldn't hear you.
I mean, you finished all the career. You finished a year, 2 years ago. When did you finish the medical school?
3 years ago.
Okay, perfect. You worked in a hospital?
Yeah.
Okay, perfect. So this case is going to be great for you. Can you watch my screen, right?
Yes, I can watch. I see it.
Okay. You are the GP on shift. Hunger, tired,
Yeah.
and many situations we know. Okay. And while you're doing your roundwords, you find that there's a diabetic patient, inpatient with the next vital signs. Angela Manriquez, 60 years old, university professor, BP 90/60, the pulse 120, so high, respiratory rate 24, temperature 38.3, and SpO2 89%, right?
Yeah.
You call the patient's nurse and ask her about the patient. And the nurse says that the patient just arrived from a room without any documentation, no papers, right? Any data because they are finishing them, they are organizing their papers, but there is nothing to support the situation at this moment. Then you see there is not a good patient and an unstable patient, right?
Yes.
And you make the secondary anamnesis, right? You decide to start because we are not for wasting time. So write down all the questions you consider necessary to complete the primary anamnesis and support the probable diagnosis. In this case, write all the questions you consider necessary to meet your patients, to know all the situation.
Okay.
Okay. So as soon as you write your questions, of course, you are going to check your patient to make the physical examination, as we know as doctors. So write down all the findings and the possible diagnosis. We know it's diabetic. We have the first point of view. But getting this diabetic patient, we have more findings to check, to look for, and of course, think about many diagnoses in this case, right?
Okay.
Maybe diabetic complications, maybe triggers that are complicating the diabetes, of course, and maybe a sepsis situation, septical patient, right?
Yes.
With all of this information, make a case report. Of course, in the case report, we were telling in the guidelines that there was not a topic to add the diagnosis. But for this homework, add the diagnosis at the end. Okay, all the ideas you have from this information, make a list with all of the situations you imagine the patient is suffering. There is no problem. And if you consider to refer the patient, tell me which one could be the best one for her and write down the referral letter. In the 7th or 8th presentation, I sent an example about a referral letter. Do you remember that?
Yeah, I think so.
Yes. Taking that example, make the referral letter if you consider it's necessary. If don't, if you consider you can treat the patient, let's do it together. I'm not asking for lab tests or imaging tests or any kind of test at this moment, because on Monday we are going to talk about them, invasive and non-invasive exam tests, okay? Investigations. So with all the clinical data, let's make the first step, get the diagnosis, the clinical diagnosis, and then the next workshop, we are going to support our ideas with the lab tests and findings.
Oh,
Is that okay?
Yes.
It's an exercise to do at this moment that could be important. Okay? And this case, I'm sure you can do it.
It says that we need to finish to Saturday, right?
Yes, the deadline is on Saturday night.
Okay.
Okay, there's enough time for doing this. And if there's any question you would like to ask, you need more information for writing down about the patient, you can send me a message to WhatsApp and I'm going to send it to you.
So we don't use like any type of lab test or anything like that, right? we only
this-
do like questions, anamnesis, and something like this, right?
Yes, the most complete anamnesis you can make. You know she's diabetic, so you have lots of view to ask for. Many questions to make.
Okay.
So be creative. Ask everything you want that is pointing to this situation.
But we don't ask for labs, right?
No,
We don't ask
not for labs.
we don't use any question for that type of question, right? Asking for this or something.
Give me an example as an example, what would you ask if you talk about labs?
Like, for example, if I say like she's diabetic, I'll probably be asking for how you say it, HbA, like hemoglobin.
Glucosyl, hemoglobina glucosylada.
Yeah, in Spanish. Right?
Yes, in Spanish. I don't remember how to say it in English, I'm sorry. But for example, if you want to ask her if she knows the latest value about this range, you can ask her, do you know which one was the value? Many patients know about it. And of course, she has a good grade in the studies.
In this case, we don't have the answer, right? So
at this moment, we don't have it.
This type of question, can we do this type of questions? Or maybe we should skip this type of question, like when we ask for a specific type of result or something like that. Maybe
at this moment, it's not necessary. We just start with this information. Remember that the papers, the whole clinical history from the emergency room is still in the emergency room. We are expecting for that, but not for expecting that the patient is going to be without attention.
Okay.
Having these vital signs, out of this objective, with your clinical, I don't know, clinical behavior, clinical criteria, what would you do if you see a patient with these vital signs? At the beginning, no matter the diagnosis at this moment, you receive a patient with these vital signs in your consultating room. What do you do at the first point, at the beginning? What's the most important part?
Well, I mean, we need to control the fever, right?
Yeah, could be. It's important to control the fever, but what you do with this BP and this pulse?
We could do like an ACG, something like that.
No. When you receive a patient like this, can wait for attention?
Oh, do you mean like, okay. So yeah, we need to attend it right away, right? In this type of case.
For example, you're in Santa Cruz, and in Santa Cruz, you can find this situation in your consultating room, because patients usually go to the hospital when they are almost dying. But this patient is not dying at this moment. She feels very bad. She feels very sick. She feels the worst in her life. But she decides to go to her favorite Dr. John Harold and says, Dr. John, please help me. I don't feel good. I need to rest and please check me. And when you take the vital signs, you find these values. What's the first topic you might consider in this situation? If you see this difference between the systolic and the pulse, you say that the patient is getting in shock.
Yeah.
And you have to correct the fluids. You have to use fluid therapy, right?
Yeah,
you have to start an infusion.
Infusion, yeah.
And in the way you know the patient is diabetic, you know which solution with infusion is the best for use, right?
Yeah.
And starting with this infusion for controlling these values, correcting the BP and the pulse, you can start looking for more data about why this patient is in this critical situation. This is a critical patient and non-stable patient.
Okay. Yeah.
It's a very, very common situation. Here in La Paz, in El Alto, we find in clinics, small clinic ones, diary this kind of patients. It's a very, very common situation. Or pancreatitis, as I am 2 weeks, I'm yellowish, and now I decide to come to see you. And when you take the lab test and check the real situation, you said how this guy is walking. The same happens in Santa Cruz. A friend of mine, well, the mother of one of my friends, one was my best friends, went to the doctor with this exactly same situation. I remember this miss. And I remember that she got a good doctor with a good point of view, with a good criteria, and he did all she needs. That's why I'm asking for you to do it. You can do it, I'm sure. You are prepared for this.
Okay, teacher. So you are sending me?
Yes, by WhatsApp. Give me a few minutes, please. First of all, let's fill the pool for assistance because we could forget it again. Okay, can you see it? Can you watch it?
Yeah.
Okay. So let me send you the pool at this moment and give me a minute, please. Okay. Let me look for your number. I have a big list. Okay. Of students, yes. Yes, I sent you the message. Did you receive it?
Yeah, I receive right now.
Okay, perfect. So you have until Saturday night. And if you have any question, you require more information and specific data, send me a message and I could answer you. There's no problem.
Oh, okay, teacher.
And we are going to work with your answers on the next workshop in order of this situation. On Monday, we are going to study the invasive and non-invasive studies, lab test, X-ray, CT scan, everything.
Okay.
So with that topics we are going to watch on Monday. Your answers, we are going to work on Tuesday.
Yep. Okay, teacher. Got it.
Okay. I think there's no questions, right?
Yeah, it was all clear.
Okay, perfect. That's great. So go for writing down and relaxing. Yeah.
Yeah.
Okay. Let me mark which case is yours. I have students in this course that are beginning the career or are not doctors, as I was telling you. And I got in conflict and I said, what I'm going to do with them. Yeah. So patience, that's all we need.
Yeah, teacher.
So Mario, that's all I think. So see you on Monday and do your homework, please.
Yes, teacher.
Yes.
Have a nice week.
Yes, you too. Have a nice weekend. Yes, we are on time. Next one is Catherine. I don't know what I'm going to do with her. Okay. Let's wait for her. Let's ask for her to get into the workshop. I'm not going to expect too much. Okay, let me look for Agar y again, I must send them the homework. the first cases for her. So, but hi, Catherine.
Hi, teacher.
Hi, how are you, Catherine?
I'm fine.
Everything's okay?
Okay, and you, teacher?
Yes, I'm fine too. I think everything's okay at this moment.
A lot hot in Santander.
Yes, we have lots of topics to check, right? Okay, Kat, from yesterday, any question you have maybe? I think it was a clear presentation,
Okay.
right?
No, practice. No.
Practice, and at this moment, we were talking about the basics that doctors perform, right?
Yeah.
So, can you watch my screen?
Yeah, teacher.
Yeah. In the way the presentation from yesterday is showing the basics, the activities that, of course, of getting information, I don't know, investigation, medical investigation, and all of this. I decided to send homework, and it's an interesting situation. You told me you work in the orthomolecular medicine at this moment, right?
Yes, teacher. Yeah.
And well,
orthomolecular medicine and aesthetic.
anesthetic, okay?
Well,
Well, maybe there's a situation not very common for you, but it's a very common situation in our country because all the time we could receive a patient in this way. And I consider for practicing, it's a good idea to take it in count, okay?
okay, teacher.
You are in your consulting room and receive a patient, Bernardo Rocha, 52 years old, a security ward. And he's telling you, Dr. Catherine, I've been feeling this headache since I started working at nights and drinking more coffee 2 months ago. But from yesterday morning, the pain is becoming worse and there's no relief taking painkillers. Your patient has a very common complaint.
Exam complaint?
Yes, he has many symptoms. He has a very common symptoms.
Diagnosis hypertension?
Yeah, let's continue.
Perhaps.
The first topic in your homework is about writing down all the questions you consider necessary to get the probable diagnosis. All the questions you need, it's important to make. Okay?
Yeah. Electrocardiogram?
No, at this moment, it's not important. Listen to me. When we talk about these questions in the anamnesis, we must consider the. Let me share the screen. I left it. Okay, can you watch my screen? Okay, you have this information. When you get any patient for the situation, you have ways for asking, right? Okay. Now you have the symptoms of the patient. The patient is telling you that he's with headache and it's getting worse. And you can use these questions or maybe more questions in a different way, or maybe different questions, I know, or maybe these ones, this and other questions for getting more information and taking all the data as much as you can, okay? Until this moment, you only make questions and questions and questions and get information for having the correct situation in all of the topics we could find, right? Okay. I'm going with the case. After the anamnesis, you take the vital signs, and here you are the vital signs. The heart rate, 105. The respiratory rate, 22. The BP, 170 and 110. The temperature, 37. The SpO2, 93. With these vital signs that you are taking, you got the diagnosis, right? But of course, you are not just taking the vital signs and start a treatment or another way of doing. You have to complete the findings, the medical evaluation. And with the medical evaluation, you have some signs, some findings, right? You have to write down all of the findings and the possible diagnosis, right?
Okay,
Now,
teacher.
we say possible diagnosis because we need more data to get it as a fact, as a diagnosis, not just the BP in one take, in one moment, right? And with all of the information, the symptoms, the signs, you must write down a case report, right?
Teacher, I'm finding a possible diagnosis with patient suggestion treatment.
No, at this moment, no treatment.
Oh, okay.
Okay, just until the diagnosis, until the idea you got with the clinical evaluation, just. No lab test, no electrocardiogram, no x-rays, nothing extra. Just the clinical part. You are without that kind of resources in your consulting room. And you said, okay, let's do my best and let's find all the situation for doing everything okay, okay?
Okay, teacher.
So
Okay.
you have the symptoms, you have the signs, and now you must make a case report. Okay?
Okay, teacher.
If you consider necessary to refer the patient, tell me which one could be the best for him and write down the referral letter. I sent an example about a referral letter in the 7th presentation, I think. The 7th or the 8th one. I'm not sure which one was, but you have an example of the referral letter. You can use that example for making this part if you think that the patient must go to another doctor. That's okay.
So my more example teacher in cause.
Okay. Do you consider that you can treat this patient in your consulting room with these values? With these vital signs?
Okay. Yeah.
It's possible to have this patient at home taking pills, or maybe he might need another kind of attention.
Okay. Yeah.
Okay. So all of this homework is important to be sent until Saturday night. Okay, the deadline is on Saturday night.
Okay, teacher.
So if you have any question, you need more information and specific data about the patient, you send me a message, a very, very specific situation, and I send you an answer about it, okay?
Okay,
now
teacher.
you are looking for more information. You have to open your mind and get in practice the topics we were talking in the module 1, right?
Okay, teacher.
Okay, any question about it?
No, teacher, no.
Okay, give me please a few minutes and I'm going to send it to you to your WhatsApp. It's going to be best. Let me send it to WhatsApp and that's all. Yes, I think it's a very common situation. We can do it. Yes, yeah. So don't worry. I'm sure you can do it. Dun, dun, dun. I have 2 cases more prepared but they are different at this moment.
Okay. Teacher, that will be the homework for this weekend?
Yes, you must send me until Saturday night. This is the first homework of the module 2.
Okay. Yes.
Yes, here you are. Yes, here you are. Yes, I'm sending the message to you at this moment. Please let me know if you receive it, right?
Yes, received, teacher.
Yes, perfect. So let's do it.
Present until Saturday, no?
Yes, Saturday night, midnight, it's okay for me.
Okay, teacher.
Oops. I lost the phone number, okay. So any question you have about it?
Answer along the question or case
No, just the questions.
Case report.
Yes, the case report is, of course, well, we are practicing how to get the correct expressions, right?
Okay, medical expression. No?
Yes, just medical expressions, as you said. Not in other ways, because they are not working. Not at this moment.
Okay, teacher.
So I sent you the guidelines for making the case report, right?
Okay.
Catherine, did you receive the guidelines for making the case report?
Yes.
Yes, use them and practice them. So yeah, I'm going to expect in the case report the symptoms, the complaints, the findings, and an extra line with the diagnosis, and that's all. On Monday, we are going to talk about the invasive or non-invasive studies. And on Tuesday, according to your answers, we are going to work on this clinical case and solve it with the lab tests.
Okay, teacher.
So it's gonna be fun. I think it's like a chain that we are working on. And that's the way I hope we can work all the workshops from this moment, writing down and practicing the medical criteria.
Yeah.
Thank you so much. So, any question maybe?
No, teacher. No.
Okay, perfect. So let's wait for your classmates.
Yeah.
Many of your classmates at this moment are on shifts and where emergencies. I've been receiving, well, some messages when they tell me I'm on shift, please, I cannot get into, and well, patience. I must understand the situation, right?
Yes, very stressed.
Yes, stressful situations.
Yeah.
Yeah, Kat, so
is very tiring.
yes. So Catherine, don't forget that when you write down the findings, try to write down as much as you can, okay?
Okay, teacher.
If you write down 20, that's okay, 20. If you write down 50, that's okay, 50. That's okay for me. As much as you can, it's better for you.
Okay, teacher.
Okay, so see you on Monday.
See you
And
Monday.
have a nice weekend. Bye.
Bye, teacher.
Bye-bye. So let me see who's the next, because I think is Mario. Mario's not coming. Let me ask Who's the next on this? On these situations. Well, no, let's send private messages because I know. Well, maybe Maria couldn't. Let me look for my students. I'm gonna look for Joyce. She's the next. Mary's not coming. Or maybe Maria. Joyce, there is no answer. Let's go. Yes. Yeah. No, that's the worst part. When nobody tells me what's going on, and I must wait and wait and wait. Zero. Well, let's wait. Let's wait a little bit and start making the they don't come tonight. Okay. Okay, not coming versus 30. Okay, so there is an exchange. Please Sorry, it was. Caray, ya está. Links. Well, let's use this time for study. Okay. Body parts. Let's make one here. Then two, yes. Let's see which they used with them. Hi, Maria. Hey, Maria, how are you?
Hi, teacher. Everything's good. How are you?
Fine, everything's okay. It's nice to see you.
You too.
Yesterday, as you said, you were telling me you arrived late, but that's okay. You have your assistance.
Thank you. Yeah, the exam was supposed to start at 8. It started at 8:20. So yeah, took a little longer.
No, don't worry. That's why I asked you for reading at the end, because
Yeah,
it's
thank
recorded
you.
that you were into the class, and that's okay.
Yeah.
Everything's corrected. Yeah. So from yesterday, did you check the slides I sent
Yeah,
to the group?
I did. I did.
Okay.
But I think it was everything clear because it was a short presentation. Yeah.
Yes, short and the basics for all of us, right?
Yeah.
So in that order, we are checking the basics, and of course, we know we have the base of all of you are studying the model 1. We have homework from this weekend. Let me share the screen. Let me find, where is this? Let me share the screen and I will explain you how it must be done.
Okay.
You are in your 5th year, right?
Fourth
and the
year.
4th one.
Yeah.
Okay. So are you taking patients? You're practicing with patients at this moment? Or not
really,
yet?
because of the pandemic, we're not really going to the hospital.
Okay, everything was.
It's not online, but we are, for example, for some classes, we're only doing more theory, actually. We're not doing anything that's actually practice.
Okay. So can you watch my screen?
Yes.
Okay. I was preparing cases in order to the place you are working or practicing medicine, okay? Because it's not the same to be in a consulting room, in an emergency room, or into a hospital as a general practitioner on shift. There are many, many differences for working and practicing in every place. But at this moment, I think that it's okay for you, this first case, because it's a very common situation in our country.
Okay.
Okay. You are in your consulting room and receive a patient, Bernardo Rocha, 52 years old, a security ward. And he says, Dr. Maria Fernanda, I've been feeling this headache since I started working at nights and drinking more coffee 2 months ago. But from yesterday morning, the pain is becoming worse. There's no relief taking painkillers. So he has a clear complaint, right?
Yeah.
He's telling you the symptoms that at this moment is sending you to the consulting room. Why he's going to visit you, right?
Mm-hmm.
With this information, you have an idea about what's going on. So the first topic is to write down all the questions you consider necessary to get the probable diagnosis just with the anamnesis. Because we know that talking the patient, we can get almost the 75% for getting the correct diagnosis. In that way, all the questions you can make are welcome.
Okay.
And for having an idea, a correct order, you have the first presentation, right? I sent to the group. And you checked it. And you have many, many ways of asking for. Can you watch my screen? Or is it still in the Word file?
It's on the Word document.
Oh, okay, let me correct it. I always make the same mistake. I don't know what's going on with me. Okay, can you watch my screen now?
Yes.
Yes.
Oh, yeah. I remember these.
We have these slides, how to ask about health and illness. And then we have some ideas how to start asking for and what's the correct order. Of course, we know it because we are in the medical school. And we have to find a way to get as much as information as we have. And we have more questions here. These 2 slides are going to be so helpful at this moment.
Yeah.
Okay, check them and make a list. No, not with answers, just questions.
Okay.
Make a list about the questions you could make to this patient and all the questions you consider necessary, okay?
Okay.
It's not an obligation to ask about, I don't know, sports, relaxed time. For me at this moment, it's not an important topic, but maybe for another classmate it's important, right? It just depends on you. It's your medical criteria at this moment.
Yeah, okay.
Going ahead. After the anamnesis, you take the vital signs and you got this data, right? The heart rate, 105, respiratory rate, 22, BP, 170 and 110. You have the temperature and the SpO2, right? With this information, now you got the diagnosis, right?
Yeah. Do I have to write, for example, hypertension and the names of?
Yes, but is a hypertension or is a crisis, a hypertensive crisis?
Okay.
That's the point. You must make the difference of this because in the presentation about the cardiovascular system, I sent you a chart with a lot of diseases and then was a classification of hypertension, right?
Yeah.
So you have to choose, you must choose which one is the best for you.
Okay.
And of course you have this data and you are not going to be relaxed just taking the vital signs. You have to make your medical examination. You have to look for some findings, some signs that are specific in this situation, right? So write down all the findings and the possible diagnosis. supporting by the vital signs, the anamnesis, and the findings you get. Of course, it's an hypertension, but which one of the hypertension classification is one?
I don't know.
You know it, you can do it. You're in the 5th year. You're just starting this part.
Oh my
Don't lie
gosh.
to me. You can do it, I'm sure. And there is
So,
an important practice for your medical practices in the 5th year and the internship.
4th year.
Is you are going to do it all the time when you
Mhm.
are finishing the school, and the next year you're in 4th. In 5th
Yeah.
and 6th internship, you are going to do it a lot all the time.
Okay.
So let's start practicing it. Yesterday I told you that the 4th and the 5th
Yeah.
years are going to be my bunnies.
It's okay. Like I truly can't remember anything right now. But
Yeah,
I guess
don't worry. Look for the signs that are most common in the hypertension. Maybe the crisis or maybe the chronic hypertension. It depends on you and the classification you get.
okay.
So tell me.
So I was thinking actually hypertension stage 2 because of the values that we have, 170.
Okay, these values are just at the moment that the patient is talking to you. And he says
Okay.
that he was starting with headaches since 2 months ago, right?
Yeah. Yeah.
So you are not sure if it's the first time he has
Mhm.
this value, or maybe he usually has these values, or
So,
maybe he
like,
knows the diagnosis or gets the treatment.
So like 2 more times should the pressure be
Yes.
measured, right?
Yes. You have to make the correct questions for having the correct answers. That's
Okay.
the way the practice is going on. Depends on your questions to get the correct answers and then the correct information.
Okay.
So be creative, think about it, and get more information, and you're going to do it. I'm sure you can do it. It's so easy. With all the information you got, make the case report of this case.
Okay.
You make the case report, and well, usually in the case report we don't write down the diagnosis. We just write down the situation we are working on, right?
Mhm.
With all the information you organized, all the questions you made, all the findings you have, you make the case report.
Yeah.
And if you consider it's necessary to refer the patient to another doctor, to a specialist, tell me which one could be the best for him and write down the referral letter. I sent an example about this handwriting, this referral letter writing, I mean.
Okay.
So with all of this information, we are going to work on Tuesday in the next workshop.
Okay.
Okay. I'm not asking for lab tests, imaging tests, invasive, non-invasive tests. That's not the point at this moment. Just making the correct questions, making the correct medical criteria about the diagnosis, about the findings. Of course, the findings need to take the coherence to the vital signs. And yesterday we were watching the basics. In the basics, we were talking about the fundoscopy.
Mhm.
It's not a common technique that we use here in Bolivia, but in Europe, in America, United States, they usually do it in this kind of patients looking for some complications, acute complications, or maybe finding chronic complications and get a better way of working, a better diagnosis.
Yeah.
So you understand what's the meaning of this homework, right?
Yes. Yes. Yes.
Perfect. In this order, the deadline is on Saturday night,
Mhm.
because I'm going to have lots of medical reports and questions of homework to read. So I need time to prepare the material for the next workshop and the class for Monday. So let's do it, okay?
Yeah. I have one more question. I know I'm extremely late with two homeworks that I didn't send. I don't know if it's still possible for me to send them tomorrow. If it's not, I totally understand it.
Okay, I know you are without time because the university.
Yeah.
And that's why I was asking you how you get into this course if you're in the 4th year, because I know how the pressure is.
Yeah. You know what? Actually, like the course started 2 months later than it was supposed to.
Yeah.
So at the time, like the original time worked perfectly because I didn't have midterms or finals yet.
Okay.
So yeah, with all the time switch and they kept postponing the start of the course, like everything started to get more complicated.
Okay. Yeah. Well, in the order tomorrow you finish the module 1 with the test.
Yeah.
So if you can send me your homework before the test, I can check it.
Okay.
Because I have to send the scores from everything and the test when you finish it.
Okay. Okay, I'll do it in the afternoon.
Okay, if you, as much as you can, because with this long homework, I'm considering 3 or 4 points. I don't remember at this moment. It's a long homework, but it has full objectives to take in count.
Okay.
Okay, so try to do it. You're the first one who's asking for about it. I received 7 reports of that homework, no more, and we are 16.
Yeah,
So,
I guess everyone's busy.
Yes. Well, actually, the ones that didn't send me the homework are not working, are just studying.
Mm-hmm.
So I said, it's your choice, not mine.
Yeah.
And
I know
sent
Bernarda,
homework.
for example, she's actually my friend. We both live here in Sucre, and I know she's extremely busy. 5th year has her crazy.
Yes, but she left the course, I mean. She's not
really?
coming she just came 2 sessions, I mean.
Oh, I didn't know that.
I don't know if she's going to continue or not, but well, the situation is not positive for her at this moment.
Yeah.
Or maybe she talked to the academical superior and maybe can take the course, I don't know, in January, when she has more time, because this course opens every 2 months.
Mm-hmm.
So we are going to finish on December 20th.
Yeah.
Maybe in January gets open again. I'm not sure about the dates. If you consider it's okay, you could tell her to talk to me or the academical superior to see the situation.
Yeah, I'm gonna ask her because, like, I think she's like having practices and classes from 8 to 10 at night. So maybe that's why she's not coming.
Yeah, she told me once, and when she told me the year she's coursing the 5th one, I said, "You are running crazy. How you are in this course?" Yeah. Because it's not an easy course. It's not a piece of cake.
Yeah.
Lots of vocabulary, lots of reading and studying.
Yeah, to be honest, I took the same course, but in German. It was easier in German than in English. It was less content. So
yes, actually, I've been modifying most parts of this course because they were without an objective. For example, there's not an objective on a presentation just to talk about the sphygmomanometer. And I said, what? It's not useful.
Yeah.
No, it's not for me. Let's make it.
Yeah.
Let's look for an easier, I don't know, let's look for a better information to show.
Yeah.
If I were a student, if I were in your place, I wouldn't expect an easy course because medical English is a extremely big topic to study, and 2 months is not enough time.
No.
Maybe a very superficial site.
Yeah, like it gives you the basics to be able to understand like the context and
yes, but it's not the basics, the book I received. It's less than the basics. That's when I said it and read it and checked the book, I said it's less than the basics. Now what's going on? Yeah.
And
let's
what
prepare. Let's
what
prepare
books do you use to prepare the classes, for example?
It's an England book, a very
Yeah.
easy England book. When I was at the university, I was telling your classmates, I studied medical English 4 years during the university because it was a topic into my medical school.
Mm-hmm.
So if I failed the medical English, I failed all the career. That was the way of studying. So 2 months comparing to 4 years, it's not enough time, of course. But taking that experience, that point of view of how we should study, I made a very, very, I don't know, resume from the resume and the resume from that. As the most important parts are in your slides. So it's going to be so helpful from this and forever.
Yeah.
And do it. That's okay.
Yeah, no, like the last thing I want to do is quit. So I like from Monday on, I'm gonna be a little less stressed because I only have finals.
Yeah.
So I'll be able to come to class and do the homework and come to the workshops. Yeah,
No,
finally.
don't worry. I understand you're on final test, on lots of activity at this moment. So maybe taking it in account, I can receive your homework. But I'm without time because preparing the classes is not an easy fact.
Yeah,
it's very mixed. On Monday, we are going to study the invasive and non-invasive studies, lab tests, X-ray, CT scan, MRI, that kind of things. In the book I received are very mixed, extremely mixed. And I said that it's not in order. Why I'm giving this information that it's misunderstood? So let's organize it. Let's make a better presentation, better slides, and complete it. And let's make something that is going to get sense with a clinical case.
Yeah.
So it's going to be so helpful. Don't worry.
Yeah. Thank you.
Please, tomorrow is possible that we start at 9 p.m. Is that okay for you?
9? Yeah. Works.
Okay.
Great. Yeah.
Okay, so I will send a message. You are going to be 3 students on the test. And I'm going to send a message you 3 about the hour we are going to start. We have 3 different tests, 1 for each student. It's not gonna be so hard. I mean, it's something that you can do if you study the slides. Everything is coming from the slides and from the homework.
I have a question. Is it going to be online or we're going to have to write it, like handwrite it?
I send you the test and you send me the answers.
Okay.
Just the answers by handwriting, not typing. Okay.
Yeah.
And of course, we have to be connected in case of any doubt or something like that.
Yeah.
We have to be in the Zoom session. I send you by WhatsApp, by the Zoom chat. That's okay. We will decide at that moment. And we wait for it. So patience, I know you can do it. You have a basis, you have a very good English level. So you can do it.
Thank you. Thank you. Yeah.
Let me ask you something. I didn't receive your case report, right?
No. Those were the 2 homeworks I was talking about, like a long homework and the case report.
Okay, a very important topic into the test is the case report. It's a complete question. Let me send you the guidelines. You and the other classmate that doesn't have the guidelines. At this moment, I'm going to send you the file.
Okay.
And let's practice with it. Okay, let's read it. It's just organizing ideas and a way of writing down.
Yeah, I would actually like write it now and send it to you if it was possible, but I have a final exam tomorrow morning, so I'm actually studying for that.
Okay, be focused on the most important one. The university one, I think it's the most important at this moment.
Yeah. Yeah,
So,
but in the afternoon, I'm gonna send you both homeworks because I'm gonna have some free time. Is that okay?
don't matter if you take more time.
Okay,
because you're on a final test. Please study for the exam, for the final exam.
okay,
Check
thank
the
you.
slides, check the anatomy reviews,
Mhm.
check, of course, the guidelines of the of the case report. A case report's a very easy fact to do. A
Okay,
very brief and short paragraph. Don't be complicated on that. Check symptoms, check signs about pathologies, and that's all. Okay.
okay,
So let me send you these files, and I think a student must come at this moment. They didn't tell me anything. Yeah.
okay. Do I have to fill the daily poll?
Yes, I'm opening it. I'm looking for this. Ah, yes, this is relaunch. Yes, can you watch it now?
Yes, I got it.
Perfect. Please fill the polls for assistance. And let me send you the clinical case for homework at this moment. And the guidelines, because they're going to be so helpful for you.
Thank you, teacher.
Any question maybe?
No, everything's clear.
Okay, perfect. So Maria, study, check the slides. Everything is
Yes.
coming from the slides.
Yeah, okay,
The anatomical reviews are coming from the slides.
okay,
Nothing is different from them, okay?
perfect. See you tomorrow.
Take a deep breath. See you tomorrow, and I'll send you
Thank
the
you.
message about the hour of the test, okay?
Okay, perfect.
Okay. Bye,
Bye.
Maria. Bye-bye.
Thank you.
Thank you. So I have one student more for receiving this information. Most of my students are babies. Let me check if there is a Well, I'm expecting Joyce, Bernardo, Micheline. But there is no answer. Well, let's give them 3 minutes more. I'm going to send a message for any one of them. Well, I sent a message. Joyce, Bernard, or Micheline, anyone please, can you get into the workshop? 3 minutes more. If they don't come, there's no trouble for me. I can go to, to practice, relax. Yeah, no, not relax. I have to start preparing this test. 3 different tests. I'm running crazy. Why should I try to do this? Anyway, I was preparing this. More person be and I. Ay, perdón. Stop. Third question. Meanings. Fourth question. Okay, report. Watch. 10 words. Very much. Reports. Let's go now. Let's wait 3 minutes more. And if there's no answer, I will go home. Yes, I will go for resting. It's strange for me. Okay. Let's prepare all the documentation. Let's prepare all the situations. Blah, 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 blah. Tired enough. Assistance. Just fill the assistance, okay? Okay. Maria Kim. Diana. Wilkin. Johan. Kent. Gan. Johan. I don't know who's him. Diana. I think there's no more people coming, so I leave the session. So everybody